Members, you're all welcome. I'm going to formally open the meeting. Just to remind members, switch off mobile phones as it will interfere with the recording of proceedings. Apologies. I have Alex Easton. Any other apologies? Right. Okay. Just a few items on the Chair's business. First of all, I think a lot of members from the committee will be familiar with the DNAV programme that was targeted towards the treatment of diabetes and was rolled out in the South Eastern Trust. It seems to be that there's been a fairly positive review done in terms of that particular pilot, but the project has not been rolled out across the other trust areas. And certainly the impact has been great in relation to the number of patients who have availed of the service. So I'm seeking approval, members, that we would write to the Minister and the Department to get an update as to what the next steps are, because it certainly has impacted across treatment and across service delivery generally. So I'm seeking approval to do that, firstly. Also, just in relation to the issue of cardiovascular services and the future of cardiovascular services, there are ongoing concerns around an ongoing review that has taken some considerable time, I have to say, with no conclusion. And certainly consultants in that sector would point to an increase in cardiovascular disease and would actually make the case that there is certainly need for at least 2 specialist units in the north, and that certainly the Belfast service is stretched. So I'm seeking agreement to write to the Department and the Minister to get an update as to when the review will be completed and any impact of decisions on the way forward, when we're likely to see or hear those. Fergal, would you?
Yes, thanks very much. Just on the DNAV stuff, certainly I'd be very happy to throw support behind. Let's see if we get some movement around that. I think the DNAV system has been proved to be effective, cost efficient, and there's a big, particularly in the Western Trust, a big diabetic population, both type 1 and 2, and we know it works in both, and we'd be keen to see some movement there. So let's get the letter and see if there can be any movement.
Okay, thank you for that, Fergal. Okay, members, item 3 then is the draft minutes of the meeting on Wednesday the 27th of January. Just to refer members to page 6 of your meeting pack. Are members content with the minutes? Thank you. And item 4 then is the Human Transplantation Bill, which we're about to agree the committee report on, obviously the committee stage of the bill. So just to advise yourselves that we'll formally consider the final draft of the committee report, and agreement will be sought on each of the sections. A copy of the report was emailed to members on Monday. It's also included in the tabled pack for today's meeting. So I just want to firstly refer members to the title page, table of contents and committee powers and membership, which are pages 3 to 5 of your tabled pack, and to put the question formally that the title page, table of contents and committee powers and membership stand part of the report. Members in agreement, okay. To refer members then to the introduction section, which is at pages 8 to 9, and to put the question, are members content that the introduction at paragraphs 1 to 9 stand part of the report? Great. Thank you. And to refer members to pages 10 to 28, which is the consideration of the bill section, to put the question, are members content that the consideration of the bill section at paragraphs 10 to 83 stand part of the report?
Agreed.
To refer members then to the clause by clause consideration of the bill, which are at pages 29 to 32, and asking are members content that the clause by clause consideration section at paragraphs 84 to 108 stand part of the report? Okay. And also to refer members to the executive summary, which is at pages 6 to 7 of the tabled pack, and the 3 amended versions. 1 with amendments suggested by Ms Dobson, one with further amendments suggested by Mr Easton and one with further amendments suggested by myself. Copies of the amended versions have also been placed on members' table. Just to advise members that procedurally I am required to put the question to the amended version first, so that if the amendment is agreed, no further questions will be asked on the executive summary. So the amended version first will be my amended version. So I'm therefore putting the question: are members content that the executive summary as amended by Ms. Mead? Yes?
Can I ask, I haven't had time to read this today.
Okay.
I haven't had time to read one. What is, can you say what the specific difference is between them, or where are we at on it? Or, you know, I want to agree if I possibly can, but I don't want to be snookered into agreeing to something that I don't agree with.
Okay, well, if I could maybe start with my own, maybe that would be more appropriate to start with. And I'm looking to clerk to keep me right on this. The additional comment was in paragraph 2, and it was simply the last line, that a view was also expressed that a robust evidence base did not exist to demonstrate a positive or negative impact of deemed consent. So it was merely a reflection of some of the evidence that we sought. Mr Easton's amendment was the end of paragraph 3, which was, however, other members felt that these amendments did not address the fundamental concerns around deemed consent as expressed by local clinicians and others. And Ms Dobson's, yes, was in relation to, wasn't it just looking to be technically correct here, that these members were of the view that the amendments would serve as a double lock and that the retrieval of organs could not take place unless a family or a person in qualifying relationship had confirmed that they had no objections. So it's very clear, very straightforward. It's a reflection of people's observations.
And all of, sorry, just to explain the process again, all of these go in, or we vote on one of these?
Yes, so mine goes first in terms of just, mine is added on to the amendments from both Mr Easton and Ms Dobson. And that's the amended. Yeah. That's the amended. That contains the 3 separate amendments. Yes, Pam.
And I think for clarification, I think there was the draft that Marie had done, and then it was amended by Joanne. Then it was amended. Then that amended one was amended by Alex. And then that amended one was amended by Maeve. So Maeve's.
Oh, sorry, I get it now. So which include everybody. That's okay.
Comprehensive.
Understood. Took me a
Okay.
minute. We're right here. We're right.
Well done. Well done.
We got there in the end.
So therefore the question then is, are members content with the executive summary as amended by myself, that it stands part of the report?
I agree.
Yeah, okay, thank you. Okay, so I just need to refer members now to appendices at page 33, and just asking, are members content with the appendices stand part of the report?
Great.
Okay, and just seeking agreement that the minutes from today's meeting are approved by myself so that they can be included then obviously as part of the report, and indeed for the other 2 bill reports that we're considering today. So I'm seeking agreement for the committee staff to make any necessary just formatting changes in advance of electronic publication.
Agreed.
There's agreement to that. In terms of publishing the report, I'm just asking that the Committee for Health, Social Services and Public Safety is content for the report on the Human Transplantation Bill to be published, and seeking agreement to issue an electronic copy of the report to all of the organisations and individuals who provided evidence to the committee and to the Department of Health. Members in agreement with that? Okay, thank you, members. Then the next item, item 5, is the Health and Social Care Amendment Bill. And again, we're agreeing the committee report on the committee stage of the bill. Just to advise members then that we'll now formally consider the final draft of the committee report, and agreement will obviously be sought on each of the sections going forward. So just in terms of the title page, table of contents and committee powers and membership, which are pages 36 to 39 of the meeting pack, I would put the question in the title page, table of contents and committee powers and membership stand part of the report.
Agreed.
Agreed. To refer members then to the introduction section at pages 41 to 42, and asking our members content that the introduction at paragraphs 1 to 9 stand part of the report.
Agreed.
Referring members to the consideration section of the report at pages 43 to 48, and asking our members content that the consideration of the bill section at paragraphs 10 to 43 stand part of the report.
Agreed.
And just refer members into clause by clause consideration of the bill at pages 49 to 50. Just to ask our members content then that the clause by clause consideration at paragraphs 44 to 53 stand part of the report.
Agreed.
And referring members then to the executive summary at page 40, and putting the question, are members content that the executive summary stands part of the report? And referring members to the appendices at page 51, are members then content that the appendices stand part of the report?
Great.
And also similar to seeking agreement for committee staff to make any necessary format and changes in advance of electronic publication. In terms of publishing the report, that the Committee for Health, Social Services and Public Safety is content for the report on the Health and Social Care Amendment Bill to be published. And again, I'm seeking agreement to issue an electronic copy of the report to the organisations and individuals who provided evidence to the committee and to the Department of Health, Social Services and Public Safety. Okay, members, moving to item 6, which is the Health Miscellaneous Provisions Bill. Again, we are agreeing committee report. Just to advise members, we'll again be formally considering the final draft of the committee report on the Health Miscellaneous Provisions Bill, and we'll seek agreement on each section. Just in terms of the title page, table of contents and committee powers and membership, which are at pages 54 to 57, I'm seeking agreement that the title page, table of contents and committee powers and membership stand part of the report.
Great.
Just to refer members to the introduction section at pages 60 to 61. Are members content that the introduction at paragraphs 1 to 13 stand part of the report?
Great.
And referring members to the consideration section of the bill at pages 62 to 66. Are members content that the consideration of the bill section at paragraphs 14 to 33 stand part of the report?
Great.
And referring members to the clause by clause consideration of the bill at pages 67 to 71, and asking our members content that the clause by clause consideration section at paragraphs 34 to 55 stand part of the report.
Great.
And referring members to then the executive summary, which is pages 58 to 59. Are members content that the executive summary stands part of the report?
Great.
And referring members to the appendices at page 72. Are members content that the appendices stand part of the report?
Great.
And just then seeking agreement for committee staff to make the necessary format and changes in advance of publication.
Great.
Therefore, that the Committee for Health, Social Services and Public Safety is content for the report on the Health Miscellaneous Provisions Bill to be published, and seeking agreement to issue again an electronic copy of the report to the organisations and individuals who provided evidence to the committee and to the Department of Health.
Great.
Okay, members, item 7 is an SL1, the Misuse of Drugs Amendment Regulations 2016. Just to refer members to page 75 of your meeting pack for the relevant papers. Just advising members that the Department is proposing to make a statutory rule to amend the Misuse of Drugs Regulations 2002, and the changes will amend the definition of health prescription, move ketamine from Schedule 4 to Schedule 2 of the 2002 regulations, and provide exemptions for continued use by specified healthcare professionals under patient group directions, and remove the exceptions applicable to prescriptions for temazepam. So that rule will be subject to negative resolution procedure. Our members are content that the Department makes the statutory rule.
Great.
Item 8 is another SL1, the Health Service Workers Consequential Provisions Amendment Regulations 2016, and it's page 83 of the meeting pack. just to again advise members that the department is proposing to make a statutory rule to comply with the Treasury requirement for the department to introduce further consequential modification to the Pension Scheme Act 1993 to ensure that the new 2015 HSC pension scheme operates as intended in terms of its interaction with the wider framework of pensions and tax legislation. So again, the rule would be subject to draft affirmative resolution procedures. Are members therefore content that the department makes the statutory rule?
Great.
And item 9 is the Forward Work Programme, pages 92 to 93 of your meeting pack. I'm just asking members to note. Item 10, Matters Arising. There are 4 items under Matters Arising at pages 95 to 101. I just want to draw attention to item 10.1 on page 95, which is the update on from the Minister on the Psychoactive Substances Bill. Good news, I think, and that the bill actually came in act on 28th of January and it's on track to come into force on the 1st of April. I think this is an important piece of legislation and certainly from the experience in the 26 counties, and this seems to be a very similar piece of legislation, had an impact in relation to, I think, in the region of 102 head shops that closed almost overnight as a result of the legislation being brought into play. So I think it is an important piece of legislation. I certainly would hope that it would reduce supply and availability and also, I think, enhance the powers available to enforcement agencies to stop those intent in supplying what are quite lethal, harmful substances to our communities across the north. So certainly welcome and one I think that we will monitor closely in terms of its enforcement. So I'm asking members then, are they content to note the remaining matters arising?
Well, Chair, if I may, on 96, I've been patiently waiting on this response. Thought it had been earlier, but it's better late than never. It's in relation to the domiciliary care, and on the back of that, there was an announcement made, I think, on Monday morning by the Minister about 1.6 million support package, which, you know, it would be nice if members of this committee had been made aware of it in the first place, but to hear it on the BBC at 7 o'clock on a Monday morning, it was welcome. But, you know, in my opinion, it's not going to go far enough, because we in this committee have been warning, particularly come April when the new living wage comes into being, it will put enormous pressure on providers to continue with the business of looking after our elderly. I suppose just to welcome it, but we're on the start of a journey, as it were, and I'm not sure whether it would be enough to encourage and keep the provision going. I don't know whether we should maybe respond to the Minister on this.
Yeah, go ahead.
Yeah, I mean, the 1.6 million grabbed the headlines on Monday, but it didn't deal with the issue by a very, very, very long way, because the independent sector will say that they need 34 million between now and April to keep the system afloat, and 9 million a year thereafter. So, you know, I think it is worthwhile communicating with the department and the Minister to see if, you know, this is a meaningful sum. What does he hope to achieve by it? You know, and further interrogating it, because, and I'm not just taking a side here, you know, if this was 1.6 million it offered, and they were looking for 5 or something, but the gap is so wide between what they say they need to keep afloat, and this is our elderly population that we're talking about. This is not something for the provision in the private sector. They are being looked after in this way, and that system is crumbling. And 1.6 million, as I say, might grab the headlines, but it's not going to deal with the issue.
Yeah, I think it's a fair point. I think that, I mean, what we've been talking about needing to do was the analysis of what we need in terms of care, you know, even from a health economist background, and I'm not sure that that's been progressed in any way. So, you know, it does beg the question, how do we deliver adequate and proper and efficient services you know, if we haven't really sort of forecast in terms of the current need and projected need.
Yeah.
So, yeah, I have no issue with writing the Minister in
Yeah,
that regard.
and maybe we should include in that whether the Minister would consider, if you like, the honest broker approach, which is inserting a price regulator into the system so that the price regulator makes the judgment on what is the value or what is the cost, of a domiciliary hour or day or whatever it is. And so that then at least we can have a researched figure with a recommendation from somebody who has that status that we then could be able to make guaranteed decisions on, supportive or otherwise.
Okay, happy to do that, members. Okay. Yes, Tom.
Chair, just I know it's what the member says is a far cry from what is required, but let's welcome what has gone forward. Let's make sure that it is 1.6 million. 1.6 million will do. It'll help out in a lot of areas where people are crying out for they really need this finance to help them, and it is a step in the right direction. And let's see then if we can work with the Department and Minister to see what more funding, if at all, we can direct in that direction, because obviously it's that type of care that is required. The health service is all moving in that direction, and therefore we need to make sure that we have the proper mechanism in place for it to deliver.
Yes, and I think all members that spoke referred to the fact that it's welcome, but we want to see the impact that that'll have and how the gap, if you like, is addressed. And then I think importantly, who's doing the planning? Where is the plan, if you like, as well? So I think that's
and one of the ways we can do that is through a price regulator, and then at least we know. At least then we'll know, and we don't have to have guesswork or even guessing about the extent to which the 1.6 million can be meaningful, or is it? Of course, it's a welcome sum, but does it go the distance? And I think we're agreeing it won't. But what would achieve it?
Just in conclusion on that there, I'm looking at the announcement and the support packages for recruitment in the care sector worker, and that has been one of the reasons why we are told that the care sector providers cannot provide, because they cannot get the staff to do the work. And this is, and now, Tom's right, 1.6 million is very welcome, but it will not go very far if you're going to have to look for, as it is, to look for staff, train them and get them into positions. So,
Okay, yeah, happy to take those comments on board. Okay, Pam, a separate issue.
It was on page 100, which is the letter from the Minister regarding cervical cancer rates, and the question had been asked about cervical smears offered to the over 25, and I know from your own constituency you'll be concerned about this too, and understand what's in the letter in front of us, and then the evidence is showing that this is the best way to do it for 25. But I'd just like this committee to go back to the Minister and ask, and I know I will be asking the question next week to him as well, whether those under 25 who maybe meet certain medical criteria or have certain symptoms, and whether they should be not refused a smear, if they so request it from their GP. I think that's important, that whilst they, the target campaign is at over 25s, that those people who are concerned and maybe possibly some kind of criteria shouldn't be refused smear under the age of 25.
Yeah, I think that's a fair point, and certainly that was part of the awareness event that I hosted here as well, that it was almost, there needed to be smear on demand, if you like, and if a young woman asked or requested, that it should be facilitated. So happy to do that, to go back to the Minister on light of that response to question how that is being rolled out across the trust area. Okay, thank you.
Chair, just one, going back to the closure of the private care homes and review, there's just one, we've got the terms of reference, but the timescale, can somebody tell me what Q1 2016 is? Quarter one, that is
of this year, so it'll be
from April to
what's quarter one 2016, so it will be April to June.
April to June.
Yeah.
So that's when we should have that report. Okay, that's grand. Thank you.
Okay, members. So item 11 is correspondence, or 9 items. of correspondence, page 103 to 159. I just want to draw your attention to one of them. Page 149 is correspondence from the Director of the Mental Health Arts and Film Festival, asking the committee to sponsor the reorganised festival launch. Just to advise members that the committee were unable, unfortunately, to sponsor the event because there's actually no room available. So I'm asking members to, are they content to note the correspondence in relation to that?
Okay.
Item 12 then is AOB.
Wait a minute. Gosh, you're in a wild rush here. 150, 153 and 155 now. Those are, in my opinion, three very serious letters that's been brought to our attention. What can we do to help on the three of them? 150 was the letter to the Ulster Hospital with a very serious problem. Individual health care, so 153 is serious stuff in my opinion, and certainly the residential dementia care, home viability. I think we must try to do something on those three.
Well, I mean, the procedure and rule that we've adhered to is that we don't get involved in individual issues, and I think we have to be very stringent in relation to that. There is nothing to stop individual MLAs for taking up individual issues, but certainly as a committee, we can't, or in my view, shouldn't. That is not taken away from the seriousness of any issue that anybody would raise, but that's up to individual MLAs, I think, if they want to proceed on that basis. So are people happy enough with that?
And Chair, just to clarify, I know we keep asking this question in different committees, but do we as a committee write back and say, these are your MLAs?
Yeah.
Okay, that's good.
Right, okay.
Okay, members, then the date,
Wait a
time.
minute.
Any other business?
Wait a minute. Any other business? Indeed.
Sorry,
You're
Kieran.
an awful hurry to get in here.
Okay.
It's
Kieran.
about the latest saga, an announcement of the closure of the Stewart Memorial Home in Bangor. Members will be aware this is a private home, and it had been threatened with closure before, and it provides for people with serious learning disabilities, etc., 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 and it's just been announced that it is going to close. I think we should write to the Minister and see where are those residents going to be placed, because I've got a letter from a parent or parents, and they are distraught. They don't know where their
I think,
daughter in this
Kieran,
case.
yes, no, and accept the serious, but again, it's a similar issue to what we just raised. We don't as a committee. Now, you can, I can, anybody around this table can, but as a committee, we don't get involved in individual situations. That's unfortunate, but that's the rule of thumb that we have adhered to, so that remains the case. Fergal?
Yes, it's the Belfast Trust figures on breast cancer that have come into the headlines, and that they've achieved the worst ever record. Only 9% of red flag cases have been referred to a consultant within the 14-day timescale, and that's the worst in recent history. I don't know what we as a committee do. Do we write to the Minister? Do we write to the Trust? Or can we seek reassurances or assurances that things will change? What?
Yeah, I mean, I think we should. I mean, be at least requesting what intervention. I know previous responses had been in and around issues of particular staff that were required, but I certainly, from recollection, there was an indication that issue was improving, had been resolved, and that was going to see much better patient outcomes. So I think, in the very least, we should be writing to get an intervention or to find out what the interventions are.
And stressing the seriousness of it. When there was the outcry in England about this some time ago, there was an outcry over the fact that only 50% were are getting the targeted treatment or consultant time. This is down to 9%.
Okay, Rosie had indicated there.
I mean, I have the same concern, and I think we need to know what actually happened, because the fear might be that is it a deteriorating situation? Is it something then could get worse? So we need to know what actually happened so that it can be remedied.
Okay, members happy to do. Sorry, Michael.
Could
Yes.
I suggest that, yes, write letters, that's very good, that we should ask the Chief Executive of the Belfast Trust to attend it. a meeting and to take us through the situation, because it's not just Belfast, this is a regional service. Very important. And he would probably want to bring along head of oncology and so on.
Well, we are
Take us
asking,
through his problems.
I was asking that the Chief Executive of the Belfast Trust come in relation to the capital proposals that are going forward. So I think, yes, we should be certainly including that clearly on the agenda with them.
Okay, thank you.
Okay, members, then definitely the date, time and place of the next meeting is Wednesday the 10th of February, starting at 2 p.m. in the Senate chamber. There we are.